Today we are discussing about Sjogren syndrome. Sjogren syndrome is characterized by dry mouth and dry eyes. You can see a test here. This is called a Schirmer test. In Schirmer test, a strip is placed below the eye in the lower eyelid to determine the tearing in the eye. And in this way, tear production can be quantified. In this test, we demonstrate the function of 7th cranial nerve. That is also a question for NEET PG. Then once the tear production is decreases, there is a chance for exposure keratitis and corneal ulceration in the patient. The antibody demonstrated in Sjogren syndrome are anti-RO antibody, otherwise called SSA, and anti-LA antibody, otherwise called SSB. So two antibody SSA and SSB. A special note here is a baby born to mother with Sjogren syndrome can have complete heart block. How this happen? The antibody cross the placenta and block the AV bundle of the baby, and a pacemaker is required for the correction of the complete heart block. And also in SLE patient, this antibody is present, that is anti-RO antibody. Then what is the investigation of choice? The investigation of choice is not the detection of antibody, because it is also seen in SLE. So the investigation of choice is salivary gland biopsy. And we can discuss a case scenario here. A female patient with dry eyes having grain-like sensation in the eye, that is dryness, dry mouth and dry vagina, and dyspareunia. Okay, the corneal ulcer also occur as a result of dry eye. Here the dye is used is fluorescent dye to demonstrate the corneal ulcer. The implication of dry mouth, dental caries here caused by Streptococcus mutans. What is the management of the patient? Management is encouraged to drink more water. Then sevimelin. This is an oral cholinergic drug that stimulates the salivary gland. Sevimelin. Okay. Then medial cellulose to prevent the development of corneal ulcer. Sjogren syndrome associated with the rheumatoid arthritis is called secondary Sjogren syndrome. What is secondary Sjogren syndrome? It is Sjogren syndrome with the rheumatoid arthritis. In secondary Sjogren syndrome, the incidence of lymphoma are higher. Okay, so we just summarize the Sjogren syndrome. Sjogren syndrome is characterized by dry mouth, dry vagina,